Welcome, everybody. We're so glad you're here with us today. May I invite you to please tell us who you are. Put your name and where you're from in the chat. I'm Debbie Plotnick. I'm Executive Director. Excuse me, I am Executive Vice President of State and Federal Advocacy at Mental Health America. And I have the great pleasure today of doing our webinar with some phenomenal guests. I want to begin by thanking our sponsor for this webinar. I want to thank Pfizer for helping us get this webinar off the ground today. And I want to say thank you to our special guests. I'm going to tell you who they are, and I'm going to give them a minute to introduce themselves while you all put your names in the chat. I also want to remind everybody that this webinar is being recorded, and you're welcome to share it after the fact with friends, family, colleagues, anyone who you think it would be helpful for. We very much appreciate when you do that. And we're going to start with a very brief introduction. We'll hear first from Ben Harrington, and Ben is the CEO of the Mental Health Association in East Tennessee. We also have with us Cynthia Finch, and she is the president and founder of New Directions Healthcare Solutions in Knoxville, Tennessee. So let's begin with you, Ben. Tell us a little bit about you very briefly, please.
Well, thank you, Debbie. It's a pleasure to be here. I've been the CEO of the MHA of East Tennessee since 1994. So that's my backstory, and we do everything from early intervention in schools to helping people find treatment and even find treatment where we assist them with the payment.
Cynthia, tell us a little bit about you, please.
Well, hello. I want to first say thank you to the associations, and being the Mental Health Association in Knoxville is phenomenal. Yep. I am Cynthia Finch. I am the president and founder of New Directions Healthcare Solutions, which is a community-led, minority-led organization that's all things health. Our existence started back in 2017, where we were doing health outreach, training, workshops. And then in 2020, here comes the pandemic. So we've added that to our scope of work. We have been laser focused on marginalized people, particular people of color. And I am just happy to be here, and hopefully what I have to share will be valuable to those that are listening. So thank you.
Thank you, Cynthia. We're going to kick things off with Ben. He's going to put things in context with what has happened in the pandemic, what continues to happen, and how COVID is affecting our communities. Take it away, Ben.
Well, thank you, Debbie. It's a pleasure to be here. Welcome to our visitors from the West Coast and Pacific Coast to the Zoom webinar, and everyone, of course, in the Eastern and Central time zones. So I want to talk a little bit about the mental health consequences of COVID, and any conversation like that has to start with, well, what were things like before COVID? So before 2020, we would always talk about 1 person in 5 needing mental health care, and that would be a number that would be true to 1 in 5 kids would need mental health care, as well as 1 in 5 adults. We would also be able to cite the fact that 50% of all Americans would need mental health care and support at some point in time in their lifetime. And we also know that the illnesses are real, diagnosable, and treatable. And of course, they start early. 50% of everyone with a mental health condition will have had their very first symptoms start by age 14, and 75% by age 24. The remainder after age 24, those are often influenced by 2 factors, either the postpartum issues onsetting after a pregnancy, because the chemistry changes the body some, and also the diseases or circumstances of midlife with chronic medical conditions precipitating the onset of mental illness, or the social situations of midlife, divorces and deaths, that sort of thing influencing. So, but in 2020, along came our friend COVID, and things changed dramatically. And I want folks to zero in, if they could, on the chart on the right-hand side of this slide, because this is a fantastic chart straight out of a Pew Research Center study that surveyed Americans in the week of March 19th to 24th of 2020. Now, before I tell you about this slide, I want you to know something. Mental Health America actually emailed all the CEOs the second week of March of 2020 and said, hey, we're noticing something strange. We've had this huge surge in people taking anxiety screenings. So we think it's COVID related, and it's got people worried. So now fast forward to this slide. Pew surveyed Americans using the GAD-7, the Generalized Anxiety Disorder screening scale. And what they found was pretty telling. And so 49% of Americans surveyed were feeling hopeless at that time, early on in the pandemic, and 43% were nervous and on edge, and 32% were having a lot of trouble sleeping because of their angst and worry, and 24% were depressed. Now, this study was not published until the end of April. And so the aha moment I had when I saw this study was, oh my gosh, we got the heads up in early March, but what if these feelings continued from March into April, into May, into June, et cetera? And I knew if it did, then those symptoms of those conditions would start to hardwire the brain all over again and change things dramatically. And that certainly would prove true. So let's talk a little bit about the pandemic. We all know the pandemic had this arc going upwards and upwards and upwards, month in, month out, for a lot of people experiencing COVID. And so as the pandemic went upward, we also saw a corresponding track for persons with mental health issues. And we saw that because of something called the Household Weekly Pulse Survey conducted by CDC. So it was really interesting to see, because we were on the same trajectory, upward and upward and upward. A lot more people seeking help. We would see it in call centers, at MHAs. We would see it at call centers, at mental health centers across the country, that sort of thing. And we would also start to see it in our own screening data, of course. So what we would end up seeing is pre-pandemic, 1 in 5 adults would need mental health care, and that was pre-pandemic. But during the pandemic, that number would change, literally doubling the prevalence in adults to become 2 people in 5. Now, I really believe that doubling also happened with kids too. So don't just think it's only adults. But so 1 in 5 became 2 people in 5. And that's really a big deal. Now, I'm showing you the largest building in the state of Tennessee. This thing is, of course, the football stadium at the University of Tennessee, can seat more than 100,000 people. So pre-pandemic, we could fill this thing one time with all the people from Knox County, Tennessee, who needed mental health care. Now, after the pandemic, we can fill it twice. And so it's a big deal. Just to give you that visual of a lot of people needing mental health care. So let's talk about the backstory. What does all the data really tell us? So the first thing is this: that Household Weekly Pulse study produced by CDC really started to tell us we had real problems with more people becoming anxiety ridden, and also more people dealing with depression. So the household pulse study showed 37% of Americans were dealing with anxiety by November and December of 2020, and 41% of adults struggling with depressive symptoms in the same time frame. So this is really a big deal, and should be worrisome for those in the mental health field all across the country and in healthcare all across the country, because it would have a ripple effect, if you will. Now, the Lancet is the British medical journal, and Lancet did a tremendous study during the pandemic. Only they studied people who developed COVID, and they wanted to find out, well, what happened to them after having COVID. And they found that 33%, so 1/3 of people who suffered COVID, would develop a mental health condition within 180 days after their COVID diagnosis. So that's critically important. So let's add those two things together. Lancet says 33% of COVID patients are going to develop a mental health condition in 180 days. CDC said the weekly household pulse survey is showing a huge surge in anxiety to 37% of adults and 41% of adults for depression. So put those two together. That's huge. That means we've got a lot more people that become help seekers for mental health care in a big way. The next piece of data, and this really shows you, Debbie, you can smile, Cynthia, you can smile. If I am reading the Asian Journal of Psychiatry, it proves I am a mental health data nerd, okay? And so the Asian Journal of Psychiatry is really an important journal to try to get your hands on from time to time, or at least get access to online. For this reason, during COVID, which COVID started in Asia and made its way all across the world, the medical schools in Asia were one of the first groups that could start to do some research. And so they researched an incredibly important population. So Lancet researched those who had COVID first. The Asian Journal of Psychiatry researched persons with a pre-existing mental health condition. And so what they found was those people with a pre-existing mental health condition who then had COVID had something incredibly profound happen to them, and it wasn't good. If you had an existing diagnosis first, then got COVID, COVID would make the treatment of that health condition extremely problematic. Symptoms became worse, harder to treat, and literally it would send most every patient back to square one to see their doctors and their nurses to try to find a new regimen that's going to become effective in treating their condition. So that became incredibly important. Now, the other ripple effect there for a mental health system or a healthcare system is, if we already have existing populations of people who were doing well pre-COVID because we were managing their conditions, now they're getting back into the continuum, going back to the doctor, trying to get it all reworked to be successful again. And that costs a lot of money for a system, because now what was working is no longer working. It might cost more because there are more visits. It might cost more because now there has to be a different medication regimen, that sort of thing. So COVID's been tremendously impactful. More people entering the pipeline because they developed COVID first, then they developed a mental health condition, or the COVID pandemic had some influence on anxiety symptoms and depressive symptoms, and then the folks with pre-existing conditions had to go back to square one and start their treatment journey all over again. Debbie?
Thank you, Ben. Sorry, it took me a second there to unmute. Ben, folks are asking, and before I start a conversation with you, about where the statistics came from, if maybe at when Cynthia's presenting, if you're able to put in the chat some of the links. People would
Yeah.
like to see like your Lancet article and so forth. But you can get to that in a few minutes.
Okay.
And you can also send that after. But you know, this is really striking. Not only did we know that we had the tremendous increase that happened along with COVID, and at Mental Health America, as our affiliates know, and for our friends who are not affiliates and may not be familiar with it, we have a screening website at Mental Health America, and we saw an explosion in the numbers in screening. Ben, I know you know a lot about that. You want to mention that too, please?
Yeah, so Mental Health America before the pandemic screened about 1.5 million people a year. And then that number started to grow exponentially during the pandemic. In the first year, 2020, I think it was like 2.6 million people. In 22 or 21, it was 5 million. Then last year was more than 6 million. So in 3 years, Mental Health America has screened more than 12 million people. And that is incredibly important because, as we know, about 78 or 80% of folks who screen, they're called screeners, screen positive for any of the conditions that you can screen for on the website. But then a large percentage start their own treatment journey, whether they are seeking a second opinion or they're seeking treatment resources through the national website or going and doing another Google search. So they start their treatment journey because they start seeking help. So it's incredibly important. The interesting thing, Debbie, is you would think as pandemic went down, the numbers would have gone down of screeners, but that has not been. It continues to keep going upwards and upwards.
It's really amazing, and we are seeing that our screening numbers have come down just a little bit, but we are seeing, and everybody is talking about, is the effects, the mental health effects. But tell us how else COVID affected mental health needs in the communities. What kinds of things what kinds of effects did it have on your community? And I know, as Ben, we really appreciate you being a national board member at Mental Health America and one of our regional policy council leaders, so that you really have your eyes on what's happening around the country, not just in Tennessee.
Yeah. So Debbie, the COVID mental health consequences really impacted every community across the country because a lot of people were affected directly or their families directly, and then they all start doing something that a lot of folks never contemplated doing. That's scrambling to try to find a mental health resource for their family, for themselves. Yeah, so that's incredibly hard. But COVID also pressured other systems too. Before the pandemic, telemedicine was more limited, but then we all had to become expert pretty quickly in using a variety of telehealth options or teleconference type video options so we could conduct our businesses. And that changed the dynamics of mental health care in a big way. We can actually serve more people because we have the ability to do it through telehealth, as long as providing it is going to be continued in every state across the country and the insurers are paying for it. We should be in good shape. But there are some things that make it a little complicated too. Certain medications should be prescribed to a telehealth client after you've already seen them and built that relationship. And then you can continue doing the telehealth. So there's been a few abuses, but we want to try to make sure folks know the communities have been pressured. A lot of folks have left healthcare because they got overwhelmed with, all the stressors of that new environment that we were in for about a full year. where there wasn't a lot of latitude. Healthcare workers had to go in and had to work through it. And that was just
Yeah.
kind of the way it was. So it was hard.
It was hard, Ben. And telehealth has been a tremendous boon. And we work very hard at our national office and our affiliates all across the country to keep the telehealth expansions that we have had under the public health emergency. And a number of states have actually passed laws to do that because, as Ben said, it certainly gives more access to people. And the fact that we are seeing more people with mental health needs is so important. Ben, you touched on this, but elaborate a little more, if you would, please, about why when COVID decreased, didn't the mental health needs decrease?
Yeah. So it's fascinating to someone like me because I've been in it for 30 years. But when the earliest symptoms of mental illness onset, there's a natural course where there's some episodes of symptoms. They start and stop, and they recede, then they start again. And the more that continues to happen, then the brain's hardwiring, if you will, starts to get rewired. And so the longer someone's dealing with anxiety, then their brain is more likely starting to change its wiring of its messaging centers and its messaging system. And so if someone's dealt with anxiety for 6 months, it's going to change things. If they've dealt with depression for a couple of months, it's going to change things. And so when COVID decreased, right, then you would have thought, well, the mental health consequences are going to recede too. But no, the brain started to rewire. And it's okay that the brain rewired because we can do some things. We can start mental health treatment. We can provide certain counseling and therapies that way, but we can also provide the right medications that can start to work at helping that person manage those symptoms moving forward. But they won't be able to necessarily rewire the brain after that point.
Ben, this is really very fascinating, but there's some other things that happen too. Tell us a little bit more about how some of these changes affected things like for folks with dementia.
Yeah.
Oh my
So
goodness.
one of the very sad parts of the Asian Journal of Psychiatry study is it showed COVID made conditions worse, and it could even speed up the course of an illness. And I think every one of us knows someone who had early onset dementia and then had COVID, and that may have sped up the course of that condition.
Yes.
Instead of being 15 years, it was 6 months, and the person passed away. And so that is the thing to be very cautious about with COVID, and that's why people need to get vaccinated and stay up to date, because a lot of people have coexisting medical conditions, and those conditions can be made a whole lot worse just because of COVID. I had a very simple allergy makeup before COVID, poison ivy, poison sumac, and fire ants. And now I'm allergic to a ton of things. And so I had a finger on my hand a while back get to twice the size because of a sting from a wasp. And so that's the sort of thing. It can change everyone's chronic health care situation dramatically for the worse. So that's why, the great work that our friend Cynthia does with vaccine clinics and reaching marginalized populations is so critical.
Ben, before we turn to Cynthia, you shared a story with me yesterday. You told me you wouldn't mind sharing about how COVID literally affected your mental health.
Yeah. So I went to a large meeting in June of 22 and came back and started feeling poorly and had to go to the doctor, and I was positive for COVID. And the next 3 days after that diagnosis, and they put me on Paxlovid, right? Because I'm a certain vintage, if you will, and have some comorbidities, that sort of thing. But they put me on Paxlovid. But for the next 3 days, I experienced one of the ugly consequences of COVID, and that is COVID psychosis. And so I had all sorts of very fascinating dreams and fascinating delusions and delusionary experiences when I was awake for the next 3 days. And so thankfully it started to get better, by the time the course of Paxlovid was ending. But, you can experience a what the Brits call an adverse mental health condition after having COVID. And I certainly did, because I was psychotic for 3 days. And the better way for me to handle it was to keep going back to bed and taking another nap, because it was some wacky stuff that I was having to deal with for 3 days.
Ben, thank you so much for sharing your personal
Yep.
story. Personal stories are the things that are so important to us in the Mental Health America family and the network, and we know the importance of that. So thank you so very, very much. Cynthia, please tell us about your work with New Directions Healthcare Solutions and reaching out into populations that were very difficult to reach into. You've done some amazing things. So thank you so much. Go ahead, Cynthia, please.
Yes. Well, Ben, thank you for all that information. I think maybe that probably even happened to me. I didn't have COVID, but was having some illusions and so forth dreaming. But I'm so happy to be here to talk about an organization that created so many partnerships during this COVID experience. I call it a journey. And I see you see the word boots. Well, we are truly boots on the ground here in Knoxville, Tennessee, and all East Tennessee. But we have had the pleasure to pivot our organization, which initially started out as a nonprofit that was doing health education, all things health, doing outreach with a specific focus on people of color. So that was our first beginning in 2017. And then lo and behold, the timing was great for us to be pulled up as an organization in the community, because when COVID came around, everybody was afraid. I jotted down the words that Ben had said that was happening to people. People were hopeless. They were not sleeping. They were depressed. They were scared. Well, I'm telling you, here in our great city of Knoxville, we were afraid because of the lack of information, the lack of access. Nobody was talking to, well, we felt like they probably wasn't talking to anybody, but we felt specifically they wasn't talking to us. And I'm referring to people of color. So we mobilized our expertise. We started communicating with a lot of experts in the community, those people that had influence, those people that were leaders, to say, hey, we need to be talking to you, and please tell us what's going on in regards to this pandemic situation, and the country's closed down and we don't have any information. Well, luckily, we had the opportunity to meet and come in contact with a physician, Dr. Keith Gray, who has now become I call a healthcare hero in our community, because he soon will be taking over the largest health system in the East Tennessee area, the University of Tennessee Medical Center. I called Dr. Gray and I told him of our fears, and that the communication that we're getting, whether it was true or not, was saying, okay, within about 4 or 5 weeks, the people could go back to church. And so go back to church when they're telling people to stay in, to stay in place. So he said, I think we probably need to call on the pastors. So here is a little bit of some pictures of things that we were doing out in the neighborhood when it came to the point where we were doing vaccinations. But the first piece of attack was our, and I'm going to come back to this, was our work with the beginning with our Faith Leaders Initiative. And this is a true timeline that on April the 27th, 2020, a call was made through that April and May period right there. I started calling everybody that I knew, and I said, we cannot have churches to reopen because we don't know about this pandemic. We don't know about this virus. We don't know what's going on. And I'm afraid that if we start letting and encourage people to go back out during the pandemic first part, that we were going to have a tremendous amount of deaths. I see someone is saying my voice is disappearing. Well, maybe I'll just kind of move up a little tad. Can you hear me now? Am I good? Can you hear me, Debbie? Can everybody hear me?
Yep, we're good.
So,
so
I'm going to talk a bit about this, what I call a movement during the pandemic. It's cutting out sometimes, but I can hear you. Okay. Well, I'll stop moving around. Okay, you're good. I see Eric says, yes, I'm good. So I'll just stay still, because sometimes when I get to talking, I get so excited that I'm moving all about being, and maybe it makes the sound go away a little bit. But this is a timeline about how we got the faith community engaged in the pandemic movement, which I refer to by just having conference calls. At that time, Zoom calls were not as known about, were not as used as much during the first part of the pandemic, well, at least on our side of the community. When I say our side, we mainly were dealing with people of color, African Americans, pastors who were African Americans, faith leaders, ministries that were particularly in the African American community. But we started this telephone call, and we started bringing what we refer to as subject matter experts to these conference calls. And these subject matter experts were people like Dr. Gray, who is a surgeon, oncologist, and leader at the University of Tennessee Medical Center. Dr. Smith, who is a scientist researcher who has contracts with every pharmaceutical company in the country to do clinical trials. We started bringing in people that were at CDC and all people in Washington, anybody that we could get to come on that 1 hour call and talk to us about what was going on. That turned out to be a tremendous, tremendous partnership with people in our community, with the faith community, with the healthcare community, with organizations like the Mental Health Association, which Ben came on and spoke to our pastors. Initially, we started out with about 104 faith leaders, and it grew sometimes to 180, 200 people on the phone trying to find out what they could take back to their churches. And at that time, many churches, they weren't meeting in person. They were doing live streaming. They were doing conference calls, mainly conference calls. So a lot of things went electronic. But we started having all of these subject matter experts to come to us and talk with us. And I want to report, Debbie, even as of today, these faith leaders Zoom calls on every Thursday from 5 to 6 o'clock are still happening. Is that not amazing? Is that not amazing that a movement such as this has been created and it's still going on? Because people want information. They want truthful information. And we start calling everybody a subject matter expert. So Debbie, when we invite you to come on to the Faith Leaders Call, you will be our subject matter expert about the mental health America across the country, and how communities in our community and other parts of the community, we started having people not only just from Knoxville, they were chiming in from bordering counties, 16 counties and around us, people in DC, people in Atlanta, they started coming. So if nothing else, this pandemic has done it's caused the faith community to realize that they have a role. They have a role in the recovery process. Because I feel like right now what we're doing is we were in panic mode. We were depressed. We didn't know. We were so we call our phase now recovery. We are trying to recover. And through the skills and expertise of all these subject matter experts, we feel like that we are on our way to do that. A little bit about New Direction and its involvement in the this is an example of subject matter experts. Go back. Let me go back. Okay, I'm not sure what's happening there, but this is an example of subject matter experts that are happening. Be on automatic go. Subject matter experts that have come to us and been a part of our Thursday meetings. Jackie, I don't know what's happening with my slideshow here, but it keeps moving back and forth. As you can see, look at all these experts that we've had and all these topics that we've had. We've had Dr. Dixon, she's way down in Mississippi talking to us about what's going on with the pediatric population during the COVID. We had Dr. Monica Crane, who came to us and talked to us about dementia and Alzheimer's and so forth, and what the impact was regarding the pandemic and its impact on people. There's Dr. Keith Gray up there in the middle. We had an epidemiologist out of Atlanta. So what we were blessed with during this period of time, New Direction and its work with its partners, we developed relationships with people that we feel like we would have never got to see before. That we would have their telephone numbers, like Dr. Gray would say, here's my direct phone number. You can call me anytime. Okay, you could call me anytime. So that's a little bit about the subject matter experts. Then we have this information. I'm not sure. It's just a little bit more about what New Direction has started with our signature project, Back Impact, to show you that we have given over 100,000 plus vaccines. We have educated thousands of people through our work, our boots on the ground kind of work. Many of those, yes, might say, wow, yes, wow. We have amassed over 300 plus volunteers. These are volunteers, some who have never volunteered before. We're not just talking about nurses and doctors. We're talking about the lay person. We're talking about people that work in businesses and industry that came. We've been able to develop some 30 plus different partnership and engage over 90 plus churches. And the faith leaders number is off the chart as it relates to the work that we have done during this pandemic. But we do call our signature project Back Impact, which tends to be the one that we present to funders, that we present to our partners to say, yes, come and be a part of what we're referring to as Back Impact. And many times it's not about vaccines, it's about educating people, educating individuals. We've done all types of outreach programs. We've looked at health disparities and some research pieces and with some of our research partners. We do COVID-19 education and information. The clinics are actually clinics that are physical clinics that we have done every place that you can imagine. Under the bridge, under a tree, at the free clinic, in churches, any place that a person wanted to have an opportunity to have a vaccine clinic because of our partnerships that we developed with a strong pharmacist here in our city who was actually had the capacity to order the vaccines and then provide the vaccines to us, to our nurses. Our director of clinical services is Ms. Britannia Sparks, nurse practitioner, and we have amassed probably 60, 70, 80 different nurses and LPNs, RNs, pharmacies that have been able to give vaccines. And then we've done, we did the testing. That was an area, being at the very beginning, that we couldn't get anybody to come to the Black community. And that's a true statement. Yeah. That we could get to come to the Black community to provide testing So I was, because of some connections and relationships that we had, we were able initially to get a team of people to bring a team from Atlanta to do testing on the front end of the pandemic. Then as the testing got more and more available, we were able to partner with our health departments, with the Department of Health, with other providers to get testing in the community. Then thus came the vaccines. So we've done a mighty work, Debbie, through New Directions and its work. When I think about some of the things that Ben talked about as if what was the impact during COVID and this whole mental health piece. One, our faith community were frightened to death. Preachers didn't know what to tell their members. Thus came the faith leaders' call every Thursday. And you know, talking about pastors, they would not miss those meetings because they was afraid they was going to miss some factual information that they could go back and take to their members. Two, we created partnerships that I feel like would have never, ever been put together had this pandemic unfortunately came about, because we had the telephone, the direct line to every major hospital system in the city. Telephone numbers of the chief of staff there, the medical director, the health department's director, the pastor's name. We had a list of every pastor, their ministers, the ministers at that church. We were able to find out whether they had a health ministry in their church. So it just created a whole lot of things that I feel like that would have not existed today had the pandemic never came. And then lastly, I think one of the things that has happened is that it has reassured our faith community that they indeed do have a role. They do have a role in whatever happens in our country. The churches and the faith leaders have a role, whether it be mental health, whether it be a pandemic, whether it be a disaster, whatever it is, the church has a role. Now, lastly, I think another opportunity for us all is to help reshape and redesign what public health is and should be. I think that is an opportunity for us. So a lot of things came out of our work. We're happy that thank you, Ben, for inviting me to share this work that we do here at New Directions in our city. The fact that I can tell you one personal story about me and how it makes me feel. I was at the Kroger's one day getting groceries, and I heard someone in the back of me say, "Hey, lady, you're the lady that saves lives." Well, I didn't think that she was talking to me, so I didn't turn around. And so I kept walking just slowly, shopping. She said, "Hey, lady, you." I turned around and she said, you're the lady that helps save lives. You got my grandmother a vaccine. You got me a vaccine. You've given our church information. So, you know, I'm almost in tears at this time. So all I can say about the work that we do at New Directions, we're still in place. We're still having our calls on every Thursday. Anybody can, if you send me your email, we'll send you the link. You can get on. You can get on. I like that. Thank you for being a difference maker. Thank you for, I'm pretty sure, what you're doing. If we had an opportunity to have all 136 people tell us something that they were able to do, whether it was their regular work, their new work, if they put it on, put it out there, we would probably have a whole dictionary of what people have been doing across the country during this journey of the pandemic. So that's a little bit about us and all that we've been doing here in Knoxville, Tennessee, and in our counties that surround us. This is I'm going to see if it'll come up. This is when one leader rises, we all rise. This is the day that we called all the preachers, all the pastors, all healthcare workers to meet on the steps when we were demanding that we'll be a part and have a seat at the table in our city and in our bordering counties that we be a part of what decisions have been made, what plans and strategies were.
Oh, it looks like Cynthia froze again there for a second.
Experts. We
I'm
have
sure
people
there
that
you
has
go.
a desire to be a part of the process relating to this pandemic.
Cynthia, this is so amazing.
Did
Can
I freeze?
ask you to go back to that slide of all the different clinics, all the folks getting their vaccines? That's an amazing picture. As we do this webinar, all I'm seeing from my end, from the comments, are all these wonderful hearts floating up and applause for the work that you have done. It has been
Right
tremendous.
there. You're talking about
and
this one here.
Well, we really appreciate it. And really what's so striking is that not only have you
You're
helped
freezing up, baby.
your community, you have had impact in other communities. So Zoom and conference calls have been amazing, and you're getting from many other states. That is quite remarkable. Jackie, maybe you can help just go back to that slide where everybody's getting their vaccines. It's really quite an amazing slide. And you really touched on some of the really important things about reaching out to communities where there's lots of disparities and where folks
Yes.
have been reluctant to come forward, but also you've touched on even leaders in the community need education. Tell us a little bit more about the specific communities, education, dispelling myths, anything else you want to touch on.
Well, in regards to education, and that's where that's the space that we are in right now, because as you know, on May the 11th of 2023, the federal government changed the model of how vaccines would be made available. They commercialized vaccines. They have another program called the Bridge program, where it is for the underserved, those that are underinsured, those that don't have any insurance, and people have been having a hard time getting vaccines, what I refer to as the updated vaccine. That's the updated vaccines. So we as a community and we as organizations, we have had to stand strong to say, we want to make sure that whatever is available for people, yes, specifically people of color, because of the disparities that have existed for a long period of time. The fact that African Americans are disproportionately impacted in all kinds of ways, whether it be diabetes, stroke, cancer, and so forth. And those individuals that had these disease processes prior to COVID, they were exacerbated during the COVID. If you had trouble with your COPD, and this virus was a respiratory type of attack on people's lungs and so forth, it just made it worse. So we began to, in our work, along with having our vaccines and our vaccinators there giving shots in the arms, we would have resource days, and we would invite organizations that provided resources, whether it be health information, whether it be housing, whether it be mental health information. We had all of that as a part of our process. We New Directions, I would say, and Ben, I think you would agree with me, that we probably have had some of the largest boots on the ground, grassroots clinics, resource days in our entire city.
Yep. And
yes, majority of the individuals that came were people of color. Whether there was a Latino community, we partnered with an organization called Centro Hispano, who deals with the Latino community. We all became the trusted messengers for these pockets of communities, whether they were Burundians, whether they were the Muslims, whatever. They came because they felt safe. They felt they trusted us. One example I gave to someone is that we had an event at a church, and we hooked up with the Black nursing sorority. And so we had all these Black nurses in there, nurses and doctors. And when all those people came in there and they saw all those professionals that looked like them, it caused them to call their brothers, their sisters, and say, come on over here to XY church. We got folks over here that want to take care of us. So, Debbie, that's some of the good things that happened is because we were able to strengthen partnerships, develop relationships with people that probably we wouldn't had an opportunity to sit in front of them and say, we want you to come and help us in our community. I recall one time when we had a mega children's clinic, a vaccine clinic, and the medical director from the children's hospital, who had, sadly to say, he'd never been over on the east side. He'd never been on the east side. So he said, I'm gonna drop in. So he came, he dropped in on that Friday night, and he said he's just gonna drop in. Well, next thing I knew, he'd gone to his car, got his white jacket out, came in and started helping vaccinate people. Then the next day on Saturday, he got there before I did.
This is an amazing story of bringing communities together, serving communities. I see lots of silver linings that have come out of this. And you mentioned about expecting, we have some changes in how vaccines are delivered. And of course, we know that as winter comes upon us and moves across the country, we're going to see an uptick in the number of COVID cases.
Exactly.
Any thoughts that you'd like to share? I mean, you've given amazing examples of building the community and then growing the community, about educating folks about what's to come. Any thoughts you'd like to share on that?
Well, I think one important thing needs to happen is that everybody doesn't know that getting a vaccine and having vaccines available to them might be a little bit difficult if you don't have insurance. The commercialization of vaccines has put a stopper, a barrier out there. Because if you go to the Walgreens to get your updated vaccines, the very first thing that they're going to ask you is may I see your insurance card? Citizens might not know that when they're pushing, yes, you can go to the big boxes, you can go to Walgreens, CVS, Walmart to get your vaccine, that now there is a big requirement that you have insurance. The rollout for the Bridge program has been slower than I think the federal government anticipated, trying to get providers signed up for what they refer to as the Bridge program. And these are things that everybody on this call can take back with them and do a little research themselves. What does it mean to have a commercialized vaccine? What does it mean to have the vaccines they refer to as Bridge? Bridge is for individuals that do not have insurance or they are underinsured. So
Cynthia,
that is
so important. Many of our MHAs, our affiliates all across the country, often work with populations where folks may be uninsured or underinsured or on Medicaid. And so tell us a little bit more about the Bridge. What do communities need to do to inform their constituencies and make this possible for more people? Perhaps maybe some of our MHA setting up this within their programs.
Well, it's a matter of identifying which pharmacies in your community are Bridge providers. And matter of fact, we just got a MOU with the University of Tennessee College of Social Work to do just that. To if it means calling every pharmacy in our community to find out, because there's not a printed list yet in communities because it's so new and it's the rollout is slower, even though things changed in May. It's a slow process of getting organizations, pharmacies, providers signed up for the Bridge vaccine. So I think if there's one thing that we on this call can do is to find out more about it ourselves. So when someone says, I can't get a vaccine, that you might be able to direct them to where they might be able to get a vaccine. Know this, that health departments, federally funded health centers, clinics, some doctor's offices are Bridge providers. Our Knox County Health Department now and they took a long time. They just gotten their bridge vaccine go ahead, maybe in the last 2 weeks. So you
Thank you.
might
This
check
is-
with your
Oh.
health departments to see, are you set up yet? Are you signed up yet with the bridge? Are you getting your bridge vaccine, so we can start referring people that we work with, our mental health clients, our people that are in these houses and places like Carm, that's where our residential places that have people that do not have insurance, where you would find them. Because the key is now that we have been educating people for the last 3 years to get them to trust us. And I'm just talking about our agency, to trust us, to say it's okay to get a vaccine. Now, this change is causing people, because we have to say, no, we don't have the vaccine now. No, you can need to go down the street. That's not something that they're used to hearing. They're used to just coming to our events, to our office, to our clinics, and getting the vaccine without any pullback. So now the pullback is happening all across the country.
Which is unfortunate. So I'm hoping, thank you, based on your example and about partnering with the pharmacies, as our Mental Health America affiliates go out and they do many community outreach events, especially around screening. This is a good opportunity for them to partner, not only taking a mental health checkup through screening and getting information about mental health, and sharing the importance of, as we get into the new COVID season, and the particular risks for developing mental health condition, for exacerbating existing mental health condition, and in helping the communities. Cynthia, we had a couple of questions, and we don't have much time, but I'm going to run this real quickly. You touched on helping Spanish-speaking communities by partnering in your community, and someone else was wondering if you've done any outreach to folks in jails and prisons. And I know that's been a tremendous problem with COVID and COVID spreading in the previous uptakes in cases.
Now, we haven't necessarily done outreach in the jails, because we left that body of work to our health departments, because
Okay.
they're county run. They're county run. So our health departments has been going into that space. But the homeless camps, the organizations that have services for the homeless, yes, we have been there. We've popped up tents. We've been inside their building. We've given vaccines, and we're still positioned to do that now, as soon as we get this bridge availability and access ironed out.
It's tremendous. We have tremendous work happening all over the country. Certainly what you've had to share with us today is inspirational, Cynthia, is
Thank
scary
you.
then, but in a way that makes us know another reason why we really have to pay such close attention as we come into this new winter season. And we have the Cynthia, what was the term you used for the new vaccine? You have a wonderful term.
I refer to it as the updated vaccine.
Updated.
Not the booster, because you go in and start asking for a booster. You're asking for the updated vaccine.
Yep. And before the call, we all talked about how we've all had our updated vaccine. And I hope that everyone on the call, of course, who are advocates, our MHA affiliates, folks who are all over the country, will take to heart the kinds of lessons that have been learned, the lessons that are ongoing, and to go into the communities and help everybody support every part of their health. I want to thank again Ben Harrington, the CEO of the Mental Health Association of East Tennessee, a member of the MHA family, and Cynthia Finch, the founder and director of New Directions Healthcare Solutions. And I want to say thank you to our sponsor, which is Pfizer. Thank you so much. This is recorded, and you will be sent a link to the recording very shortly. Thank you, everyone, for joining us today. And take good care.
Peace out.